Namaste, I am JVN Dr. Priyanka BAIRWA from Faculty of Physiotherapy and Diagnostics. In this video, my topic is ethical principles in healthcare. So let's start. The principles of healthcare ethics. The language of ethics related to healthcare, also commonly called bioethics, is applied across all practice settings, and four basic principles are commonly accepted. These principles include autonomy, beneficence, non-maleficence, and justice. The principles of autonomy. Autonomy is an American value. It is the ability to make decisions for oneself, also known as self-government. We hold great respect for individual right and equivalent freedom with the autonomy. Our system of democratic law supports autonomy and such as uphold the right of individuals to make decisions about their own health care. Respect for autonomy requires that patients be told the truth about their conditions and be informed about the risks and benefits of treatment in order for them to make informed decisions. Under the law, they are permitted to refuse treatment even if the best and most reliable information indicates that treatment would be beneficial, unless their action may have a negative impact on the well-being of another individual. This conflict set the stage for the ethical dilemmas. The principle of beneficence. The beneficent practitioner provides care that is in the best interest of the patient. Beneficence is the act of being kind. The action of the healthcare provider are designed to bring out a positive outcome. Beneficence always raise the question of the subjective and objective determinants of benefit versus harm. A beneficent decision can only be objective if the same decision would be made regardless of who was making it. Traditionally, the ethical decision making process and the ultimate decision were the determination of the physician. This is no longer the case. The patient and the other healthcare providers, according to their specific expertise, are central to the decision-making process. For example, case managers have expertise in quality of the life issues, and in this capacity can offer much to the decisions of the lifestyle and the life-changing choices, particularly when dealing with the terminal decision and the end of life dilemmas. Next is the principle of non-malfeasance. Non-malfeasance meaning doing no harm. Providers must ask themselves when whether their action may harm the patient either by the omission or commission. The guiding principle of the premium non-nourishing. First of all, do not harm, is found in the Hippocrates oath. The the actions or practice of the healthcare provider are right as long as they are in the interest of the patient and avoid negative consequences. Harm by an act of the omission meaning that some action could have been done to avoid harm but was not done. Omission would be failing to raise the side rails on the patient's hospital bed, upon which the patient fell out and was injured. An action of commission is something actually done that results in the harm. An example of an act of the commission would be delivering a medication in the wrong dose or to the wrong patient. Case manager can be assumed accused of the malfeasance by the omission if they fail to, to coordinate a patient's care correctly. For example, discharging a patient to an inappropriate level of care and leaving a patient in a dangerous living situation. A key role for the case manager is to be an advocate for the patient, and neglecting this role could be maleficent. An unethical act of the Commission could be breaking confidentiality by releasing information that becomes harmful to the patient. Patients with the terminal illness are often concerned that technology will maintain their life beyond their wishes. Thus, healthcare professionals are challenged to improve care during this end stage of life. Patients may even choose to hesitate that if options are available. The right of individual to choose the die with dignity is the ultimate manifestation of autonomy. But it is difficult to healthcare providers to accept that when there may still be viable option. Indeed, in the most states, it is still illegal to hasten death by any active means. Next principle is the principle of justice. Justice speaks to equality or fairness in treatment. Hippocrates relate ethical principle to the individual's relationship between the physician and the patient. Ethical practice today must extend beyond the individuals to the institutional and the societal realms. This means that in addition to providing fairness in the treatment to the patient, the institutions and the staff must all be treated fairly. For example, it is not fair if a patient could not make payments and the institution has to pay for the treatments already given for the patient's benefit. Justice may be seen as having two types: distributive or comparative. Distributive justice addresses the degree to which healthcare services are distributed equitably throughout society, which is the logic of the descriptive justice. We sound treat similar cases similarly, but how can we determine if cases are indeed similar? So, um, okay. BA camp and child raised, identifying six material principles that must be considered while recognizing that there is a little likelihood all six principles could be satisfied at the same time. Same ones, which is principles of justice to each person, an equal share to each person according to need, to each person according to effort, to each person according to contribution, to each person according to merit, to each person according to the free market exchange. So, thank you. If you have any concern, any questions about this topic, you can write in the comment box. This video is powered by digital session of 2.0 and खुश रहिए बिटिया